Hello everyone. So now, to know what is happening with in the body and echo in PDA, we should know the anatomy of PDA, that is patent ductus arteriosus. As you will be seeing in this figure, you are seeing the ascending aorta, the three branches of arch of aorta, and then you see the descending aorta. The PDA starts from the area that is known as isthmus. Most commonly that is a part of the descending aorta just after the third branch, and then from there it arises and goes and meet main pulmonary artery towards LPA, that is the left pulmonary artery. So as you can see in the other figure, which is a simplified drawing, so there also you are seeing the arch of the aorta, three branches, and from the isthmus the PDA is arising, and then it is being joining the blue colored MPA, that is the main pulmonary artery, towards the LPA side. So that is the normal anatomy of the PDA. So it is very important to know this, because then it will be easier to understand that if the blood is flowing left to right, so from where the blood is flowing to which part of the heart and how it will affect. So as you can see in this animation, the PDA, if it is there, it is a joint between descending aorta and the pulmonary artery, and you can see if the blood is flowing from descending aorta to pulmonary artery, it will be left to right. Why we want to know this? Because it is important in the echo to know the size of the PDA, and then to see the blood dopplers, blood flowing through the PDA, and do its dopplers. It is very important to make the assessment whether it is HSPD or not. In this you will be seeing that how to take the ductal view. As you can see on the mannequin, the probe has been kept in the high parasternal view on the left side of the sternum, and probe orientation marker on the screen is on the upside, and you will be seeing this blue color, that is the main pulmonary artery, and then another vessel from down, that is the descending aorta. So if there is a PDA, it will be a connection from descending aorta to this main pulmonary artery. And when we put the color dopplers, if the flow through the PDA it is left to right, it will be seen as red. As you can see in this, there are two blues you will be seeing. One blue is, upper one is main pulmonary artery, lower one is the descending aorta, and the red one is the duct flow, which is shunting left to right. And the size of the PDA we tend to measure, which is the most constricted part, and that will be when it enters the pulmonary artery. As you can see in this figure, the most constricted part when it enters the pulmonary artery, it is the part where we do the measure the size of the PDA. And in this we are doing the live demo for the ductal view. So it is, ductal view is one of the high parasternal views, and the probe is being kept in the upper 1/3 of the sternum on the left parasternal area. Pointer is pointing at 12 to 1 o'clock position in the left subclavicular area, and if needed you can sweep the probe bit on the left side, and on the screen you will see the probe orientation marker is up there, and what you will be seeing is this pulmonary artery MPA, and then this descending aorta. The other vessel which is going from down, you can see this black one, is the descending aorta. So if there is a PDA, then the PDA will be from descending aorta and go up and join the main pulmonary artery. When we put a color, you will see the two blue colors. One blue is the MPA flow, another blue will be the blood flowing through the descending aorta. If there is a PDA and shunting left to right, it will be red. If it is shunting pure right to left, it will be blue. As you can see in this animation, the probe is up there colored blue, and the blood flow in the MPA is and descending aorta is moving away from the probe, so it is blue. And this PDA, which is joining from aorta to pulmonary artery, if there is left to right, that is aorta to pulmonary artery blood flow through the PDA, it is red, and if it is right to left, that means it is away from the probe and it will be blue. And you can do the dopplers by putting your pulse wave doppler within the